More than 50 local pharmacies across South Dakota are administering doses of the COVID-19 vaccine.
Through the CDC's retail pharmacy program, the goal is to expand vaccine accessibility to the general public. In tonight's Eye on Kellerland, Max Hofer shows you how the process is going so far.
Beverly Harder has been waiting months to get her shot at the COVID-19 vaccine.
My husband already has had the shot, so I was waiting for my turn to take and do it.
She says she's been waiting on her doctor to let her know when she'd be eligible. But after a month of hearing nothing, she decided to reach out herself.
I investigated here at Lewis, and they said that they would be open.
She set up her appointment online, and just a couple days later is getting her vaccine at the Lewis Drug Pharmacy on 41st and Marion.
Once they get here, we just kind of reconfirm, who they are. We verify an ID just so we know who we actually have in front of us.
After some quick screening questions, she rolled up her sleeve and got her first injection.
It was easy as could be. There was no big deals, no just taking and waiting till he was ready and do it and get out of there.
This accessibility made it possible for people like Harder thanks to the federal retail pharmacy program. It's a partnership between the federal government and all pharmacies in the U.S. to get the vaccine out fast and efficiently. Kyle here is the store's chief pharmacist and has been giving the shots himself for over a month.
It's been very educating, kind of very gratifying in a way to make sure that we know that we are providing this service to the public. It's given us a chance to provide the service when we are needed most.
He says there's over 30 Lewis pharmacies in South Dakota where people can get their vaccine.
We currently have both at times. It kind of depends upon our federal allotments and what comes to us. But we traditionally have been doing most of the Moderna vaccines. But we have also just recently started doing some of the Johnson & Johnson as well.
Harder got the Moderna vaccine. She says that taking this shot won't just improve her health, but her chances of visiting her 90-year-old mother who lives in a nursing home.
It's really for her. It's for my health, but it is for her too. So I'm excited about the possibilities of this all opening up the chances to take and do more visiting with her.
She has been able to visit her during the pandemic, but with heavy limitations.
It's just the limitations that are put in there of behind plexiglass instead of close-up visits and that kind of thing. So I'd love to go to her room and see her there and visit with her there.
She goes back for her second shot in 4 weeks. For those still looking to get their first, here says that that's up to the public to check for times and for their eligibility.
So there's no set schedule to when the time slots open. So the only way to really know is just to regularly check that, unfortunately. But I said it's all based on when we receive shipments in from the government, actually. And then as soon as we can get the slots open, we can actually get our distribution schedule put together as far as for getting it out to our out-of-town stores or even our in-town stores for that matter.
When it comes to people deciding on whether or not to take the vaccine, Harder had this to say.
Let them make the decisions, though, on their own life. But if it helps control what is going on, I would say it's good for most people to do it.
With every shot comes another step on getting back to normal.
Glad I got this one done and scheduled, and now I'm ready for the second one, and hopefully things will even open up even a little bit more with nursing homes and everything for freedom of doing that.
With Eye on Kellerland, I'm Max Hofer.
If you wish to check your eligibility and sign up for a COVID-19 vaccine, we have a link that can help under this story at kellerland.com.
Well, for the second time